for a lot of vitamins is that we don't have reliable testing to see people who have kidney disease seem to have 3 to 4 times the normal vitamin.
Hi, everybody. Welcome to the Kidney Coach YouTube channel. I'm naturopathic Dr. Fiona Chin, co-founder of the Kidney Disease Solution and head formulator at Genesis, our nutritional range of supplements that go with our Kidney Disease Solution program. And I'm joined again today by the amazing Lindsey Zerka. So we thought today we would dive into the world of vitamins and which ones are super important when it comes to kidney disease. So shall I just hand it across to you and you can take the floor with all things vitamins and kidney disease?
Sure. Feel free to ask any other questions or remind me of things that we want to talk about. I think one of the big questions when it comes to vitamins and kidney disease is, people are always asking, like, which ones should I take? Is it okay if I'm taking this much? And I think there's a lot of concern because a lot of the vitamin supplements, they have like how much of the RDA or the DRI or whatever that they're meaning. It's like these gigantic percentages and people are like, is that making extra work for my kidneys to have to filter all that out? And, why do they keep putting this much stuff in here? Should I only take this vitamin like once a week now? Like, it gets pretty confusing. So everyone is like always really concerned about vitamin A toxicity and kidney disease.
Yes.
So interestingly, when I actually went and looked at the research, it's pretty controversial in the paltry amount of research that there is. So like just assume overall there's not very much research on vitamins and kidney disease. So that's a given. There's not going to be great research on it. What they found, so I think the reason for vitamin A toxicity is that people who have kidney disease seem to have 3 to 4 times the normal vitamin A plasma level. So it's just higher. But the thing that I think is an important consideration, they do not have toxicity symptoms.
Exactly. It's such a good point.
So the other thing that they found, and again, these aren't like clinical trial type ones. Most of these vitamin studies are going to be like, just observational type ones. So that's what they're finding. The other thing they found, like, for instance, in dialysis patients, hemodialysis patients, people who had the lowest vitamin A levels, even though it was above the normal concentration, they had increased risk of mortality.
Yes, I read that same study, which I found fascinating. And then you go, is there a mechanism going when you've got chronic disease, why people have high plasma vitamin A? Maybe that's a preservation mechanism happening in the body to prevent stuff like that. It's fascinating.
Yeah, it is really interesting. And like, I was kind of thinking in my head, I'm like, why is this the case? And I mean, when you think about what vitamin A does, there's a lot of things that certain vitamins are, kind of famous for. So I think a lot of people for vitamin A, they think of like eye health and things like that. But vitamin A actually, it plays a really important role in like cell differentiation so that, your cells know that they have different jobs and they can do that. Also with healing and tissue repair. But also it's an antioxidant, has a lot of antioxidant activity too, right? And so it kind of makes me think of that with, vitamin C and increased needs, well, yeah, maybe it's because there's so much inflammation running around. The body's like, we're pulling all hands on deck to try and get some extra support here. And maybe that's why vitamin A levels are increased. But vitamin A also helps mobilize iron from storage sites in helping to develop red blood cells. So I feel like there's a component with the anemia issue as well. So I think takeaway from vitamin A is that one, again, this goes for a lot of vitamins, is that we don't have reliable testing to see how much vitamin is present in the body, because there's usually a lot of different forms, and vitamin A is definitely, there's tons of different things that kind of happen with that. And so we maybe need to check a different form, or we need to check different types of things to really assess what's going on with it. And so that, kind of considering, are there toxicity symptoms happening if, vitamin A by some miracle actually got checked in the first place? But don't be afraid to be eating, foods that have vitamin A or beta carotene or retinols in them, because, a lot of them are going to be in, lovely fruits and vegetables, or even those high quality protein foods that your body probably needs.
If you want to know more information about what we do, you can head to www.kidneycoach.com. You will find our shop there. We've got renal supplements and herbs there as well. Make sure you hit subscribe and like. That way you'll get notified anytime we put out a new video. And if there's any content that you want Lindsey and I to talk about, or anyone else, make sure you drop it in the comments below and let us know, and we'll make sure we do that. Lindsey, thanks again for your time. As always, I always appreciate that amazing brain of yours. And thanks for being part of our team and community, everybody. Thanks for listening. See you next time. Thanks, Lindsey.
Thanks, everyone.